All right, we are back with our Mental Health Matters phone bank and really some cool breakout discussions that we are able to have about mental health. And sometimes they're raw, sometimes they're hard to discuss. And I'm really excited to talk with both of you all as you have gone through some a mental health journey, I'll say, on the other side. You know, I mean, the thing with mental health is it's always something you have to address. Mm-hmm. It just doesn't get better. It doesn't heal like a wound all the time. But what you've done is taken what you've experienced and turned it into an opportunity to educate and help others. So I want to introduce Consuela Kelly, who, when she came in the room, she said, "I am here for my debut." So I love it. I said, "You're going to go on camera." She said, "Let me put my lipstick on," and you're beautiful. And I'm so happy you're here to talk with us today.
Thank you.
We have Wendy Weismuller, who is also a peer counselor with NAMI Jacksonville, which is another great organization. You all I love that you are motivated to do something. So, Consuela, you want to start maybe with your story?
It's a passion for me. I love doing this due to the fact that my mental illness started at the age of 18. I'm 61 years old now, and I really, really understand what it takes to overcome this illness or disease, they would like to call it. And it's something that takes a lot of work. It takes a lot of work. You have to have that drive to know that you can be functionable out here with the illness. And that's how with me being with NAMI, it has opened up so many doors and things for my family, friends, neighbors, everything,
resources,
everyone.
Resources
Those are the
and help. And 18 years old, how did it manifest itself for you?
Ooh. I had a daughter at the age of 18. I had postpartum blues, deep depression. That's what it started out. And then it just escalated from there with all the different names that they have categorized me under. But I just didn't, it took time. It took a lot of time, a lot of work, and my grandparents, my parents, all of them, you know, took care of me with beautiful. It's like
care.
Yes, they were there. They were there for me, and you know, it's just a blessing.
Let me ask you just quickly. When did you start getting help? At what age?
Oh, 18.
You at 18?
Yes.
Okay, so there was
18.
intervention quick for you.
Right. As soon as I had birth, I went to. I'm from New Jersey.
Okay.
So I went to the local hospital. My daughter went home, but I stayed.
Wow.
And I went to the 4th floor.
Wow.
And I stayed there for many times. It was, I think my daughter was maybe about 6, 7 months old. My mom took care
of her.
My family took care of her.
You had the resources, and you also had the love and the help.
Yes.
Wendy, it was funny. I'm sorry to interrupt you, Consuela, but you know, you said Consuela's coming. You know, you were really excited to hear her story. How did you get connected? Because you have your own story.
So when I was 17, that's when I first had my mental health diagnosis come on. I was a senior in high school. I was fortunate enough to have parents and family members that recognized something was going on. When I was 19, I was kind of feeling alone. I felt like people didn't understand what was going on in my head. I had supportive family and friends that loved me, but they didn't completely understand what I was going through. And that's when I found NAMI. At that point, I was living in Orlando, and I connected with them. My mom would go to the family group, I'd go to the peer group, and that's really the first time I felt understood and heard. I met someone there with a similar diagnosis as me, and she just gave me a lot of hope, encouraged me to go to grad school and things like that. And then when I moved to Jacksonville, I linked with NAMI Jax. And just having that sense of community is like so important. I work for them now as a peer program coordinator, so I have the opportunity to go out in the community and share my story.
So if someone's listening and they don't even know what NAMI is, tell me the different facets of it and what it does.
So NAMI, we're a peer-run organization. So we're either peers like myself living with mental health conditions or family members and loved ones with mental health conditions. And they run our programs. We have support groups, we have classes, we have presentations, and we have different conversations in the community. And what's great about NAMI is it's free access and at any time. So if someone needs to get to a support group this week, there's going to be one they can get into and get that support while they're waiting for extra help.
What great. You guys have such wonderful stories because you started with a tight family that was able to see you and they were able to make sure that you got the services and you had them at a young age.
Yes.
How do you go from having a mental health issue and working through it your entire life to actually helping others? It sounds like, how does that work?
For me, it was, I started off in the service industry working, and then I got an opportunity to train as a peer specialist. And that's really when my work switched from work to not feeling like work at all. Being able to have that perspective of lived experience really helps me to be able to meet people on a level that other people might not be able to meet them at. Like the woman in the group that made me feel warm and welcome and supported. And like I said, I've worked in peer stuff since 2014, and I've never felt like I've worked a day since then.
How helpful has that been for you?
It's been very helpful for me. I moved here to Jacksonville in 91. Then I went to Wacaiba Springs, and I went to a senior group, and I really wanted to know what can I do after I be released from this organization, and so they recommended me to go to the NAMI.
Okay.
And I was like, wow, you know, and the instructor that I had at Wacaiba got me involved with a NAMI, and I then grew from there. I'm a facilitator.
Okay.
I'm in your own voice. I also work for FSCJ.
Wow.
And I'm a mental health. Well, I work for Disabled Services.
Wow, you stay busy.
Yes.
Good job.
I have to.
You're using your
Yes, I have
your life experiences and everything that you've learned. What does it take to be a peer counselor?
So there's different steps. They can actually go through trainings with NAMI to build toward their certification, and also just getting hands-on volunteer experience or work experience. You can get service hours doing advocacy, group work, peer support, and you hit all those categories. And what's great about peer specialists is they're really expanding and growing in the country. So.
Anything else that you can think of, you know, just to motivate someone who's out there struggling alone? I mean, because what I've learned today is that there are so many people out there who are in that same position.
Yeah, I think taking the first step and going to that first meeting or class is so important. And we're also having our NAMI walks coming up in October,
that's right.
which is October 19th by the Winston YMCA. And just getting out there and seeing like hundreds of people there who are there to support mental health is so powerful. So that might be a good step to really see the advocacy at work.
All right, September 19th. Don't miss it.
October 19th.
October. I get my dates wrong. October 19th. Okay, thank you all so much. Thank you for sharing your story. Thank you for the work that you're doing. All right, you know the number to call, 904-346-4630. We're going to be here till 7 p.m., so please make those phones ring. We are here for you.